Good morning, everyone. My name is Chi Jen, the medical lead, Northwestern region. So today, together with Brother Jim, we will give an update on our medical mission 2020. Brother Jim, please.
Sure. Thanks, Brother Chi Jen. I can't help but echo Brother Dr. Nguyen's message about 2020. It has been a most unusual year for us in Northern California. Of course, we were affected like the rest of the world with the coronavirus. In the US, we have the Black Lives Matter protest, and unfortunately some violence that goes along with that. But in particular, we've had a lot of fires here in Northern California, and even today I walked out this morning and you just smell like you're in a campfire. There's the smell of smoke, and the haze is covering the sky. And I suspect many of you saw the pictures, I guess it was now about 2 or 3 weeks ago, where we had the Orange Sky event. The street lights were coming on at 3 in the afternoon. So there's just been a long year, and we're looking forward to some rain maybe in a week and a half, which will help the fire situation. And of course, ultimately, the COVID-19 and a vaccine that will help push that down. We were, like many areas, unable to do much this year as far as dental and medical outreach. We held, excuse me, we held a 2-day dental and medical outreach up in the Chico area, and that was where in 2018 there was the campfire. Many people are familiar with that fire because I think 85 people lost their lives and thousands of homes were burned down. And we've kept in close contact with that region, and we held a dental medical outreach in Magalia, which is right adjacent to Paradise, the city that was hit the worst. And then a little bit farther down the road on a Sunday, we held an Oroville outreach. And it was very good to be able to connect not only with each other, but to connect with all of the people that we touched through our initial emergency relief that we held up there. We did have a kind of a unique event scheduled for mid-February. We were going to provide dental and medical care to the migrant community that works in the fields around the Bay Area and actually into the south, and Gilroy, Watsonville, Santa Cruz, and Salinas. And unfortunately, we did have to cancel that event because of the surgence of the COVID-19 pandemic. In place of that, of course, we started, like many regions, to focus on what we could do and not what we couldn't do. And that means providing personal protection equipment to the hospitals initially that were really in dire need at that time for, in particular, masks. And then, of course, just recently in August, we had a rather freak event that has never occurred in California with a lightning storm that came through, particularly in the Bay Area in early, I guess it was like the last day of July, and set our whole area on fire. Next slide, Chi-Jen. So, of course, with the support of Master and supplies from China and Taiwan, and of course, coordination through our US headquarters down in Southern California, we were able to deliver over 300,000 personal protection equipment and to over 50 hospitals and 120 institutions. You can see that the majority of what we delivered were surgical masks, 257,000 plus. But we were also able to provide N95 and KN95 masks, some protective equipment and isolation gowns, over 8,000 goggles, 1,000 face shields, and gloves. And many of the masks, of course, the surgical masks were provided and manufactured outside the U.S., but many masks were actually manufactured by our local volunteers. Okay, Chijen, next slide. So the next slides, of course, like many presentations you'll see today and I've already seen, is our outreach in delivering these personal protection equipment. Our first efforts were to provide support to the Valley Medical Center, which is the major medical center that is open to the public, serves the public in San Jose, and to the Kaiser San Jose office. One thing you should notice that this was early on in the pandemic, and so we're wearing gloves, we're wearing, of course, masks. We, as much as possible, kept distance. Of course, when you deliver boxes, or you put them on a cart or you hand deliver them, you have to get relatively close. But you'll see that over time, we all grew a little bit more comfortable with how the COVID-19 virus actually passes. Next slide, Chijen. So we, of course, initially focused on hospitals. Here in the lower right, you can see that we're at University of California, Southern San Francisco Medical Center. All of these are hospital donations. You can see boxes and boxes provided. And really, they were very appreciative of the efforts that we provided. It was clear that they were undersupplied. We had heard stories from individual doctors and nurses that they were having to wear masks 4, 5, 6 days in a row because they just were not equipped to manage the rush of patients that they were seeing. Next slide. Beyond the hospitals, we were actually delivering to other facilities. Here you can see we were delivering to a police department up in the right, left-hand corner. You can see Brother Chijen actually handing out masks to the migrant workers out in the fields. So we were supporting nursing homes and rehab centers. We actually gave masks out at grocery stores, restaurants, a number of our community partners. Wherever we heard of a need, we had kind of a registration process going, and weekly we would get on calls to kind of evaluate the needs and prioritize those areas that really needed them the most. And our volunteers took the risk, clearly, of going out and packaging the masks and going and meeting with these people in person to deliver them. Next slide. We, like other regions, were proud to cooperate with the Santa Clara County to hold a COVID-19 testing center. We did this in July, where actually the Santa Clara County nurses did the testing. We simply did an outreach to all of our volunteers and the community that we support. And we were able to serve 154 people that day with COVID testing. And you know, there were so few opportunities for our volunteers to actually do what we normally do in helping others and doing good deeds, that we got overwhelming support by the volunteers to support this event. It was something that our volunteers could really sink their teeth into and feel like they've done their part. And that was sorely missing for most of this year, and continues to be, certainly on the medical and dental side of things. Next slide. Beyond all of these other organizations, we didn't want to forget our own volunteers, and particularly the dental and oriental medicine volunteers that come out when we are able to hold these outreaches. And so these are all pictures of us donating masks primarily to the dentists that are coming out and volunteering. And what I want to draw attention to is, here we are, okay, we're much closer together than this is. Let's say this is late July and August. It's 5 months into the virus, And now we're actually much closer together, taking pictures, side by side, which is probably not such a good thing, but we understand how the airborne transmission of the virus is such a primary way of contracting the contagion, that if we are diligent about wearing masks, and clearly we all are, and we wash our hands with sanitizer and soap and water when we get home, the risk is very low. And so under each of these masks are people smiling, happy to be helping others.
All right. So Master has reminded us to adopt vegetarian lifestyle all along, more so when pandemic started this year. So in every single occasion I recall, Master clearly pointed out. So in this particular event during the pandemic, this is an Clara partner with Stanford to offer COVID-19 testing. So at the end, on the way out after testing, Tzu Chi will provide care kit to each family and provide and promote the vegetarian diet. Each family will pledge to have 1 or 2 meals every day. So during the with pandemic and shelter in place, the only thing that we can do is to stay vigilant, take protective measures such as washing hands, wearing masks, social distancing. However, our traditional Chinese medicine department was thinking what they can do during this challenging period. And thus, this seminar appeared, topic ranging from epidemic prevention, strengthen immune system, good food, good mood, positive energy, to how to maintain a healthy and peaceful lifestyle during the pandemic. So during this, up to the end of the September, we have 8 sections conducted by six doctors. And we have close to 2,000 people attending this seminar. This is just some of the screenshots that I did for the various different sections. I really appreciate Dr. O, Dr. Mike, Dr. Lin, Dr. Wang. And then we have a couple of doctors actually online today with us as well. So Brother Jim mentioned this migrant education program by Santa Clara County. So this is the event that we actually cancel the service, outreach service, but we kind of adopt the different approach to help them out for the children's learning device. So in this program, county identified approximately 20 families in the Bay Area, or even in Santa Cruz or San Benito County. So volunteer went through a phone interview and then identified the children that would need the learning device. And we actually do the home visit and also the drive-through, depending on the how was conducted. So the home visit was accompanied by the county advocate, and this allowed a volunteer to gain a first-hand understanding of each family, their need. In particular, when our young volunteer, Christopher, interact with the kid directly, they actually establish a closer tie between them. And we will continue to follow up and see how their learning progress is. So Jim mentioned the only medical outreach we had in Chico in 2020 is the end of January in Chico. We can see our TCM department, dental department, and also our podiatry, Dr. Zhuang. He actually drove a couple hours from Bay Area and just served a few hours. You can see that we have served 5 patients there, and then drove back on the same day. So people, and during that time also is a Chinese New Year, so we have Sister Minlin was actually distribute our master red envelope to each patient, and also the volunteer that on site there, and with people donating the money there. So it's actually very memorable, very joyful event, as you can see all the volunteer and doctor. very joyful, very cheerful after a long day of event. So even without, after February, we don't have any medical service, but the medical team is not idle. So we continue our monthly meeting. We encourage interaction with our doctor. We do continue to maintain our dental van, portable unit. And then also for the service scope, we review that vision and chiropractor, so that we're thinking about in the future, what else we can do to expand that service scope. And also we design our intranet site for the better information sharing and access. Yep, that's all I have. I want to thank you all our volunteers and the doctors, nurses in the region to make this our medical mission possible. Thank you.
Very much, Brother Chi-Zhen, and as well as Brother Jim, for your presentation. You guys definitely have done a lot during the pandemic, and you guys are very well organized as well. So thank you very much. It makes our jobs a lot easier to keep track of which PPEs you need and to make sure that we ship it to you on a timely basis. So thank you very much.